Okay, we'll go ahead and get started, and as people trickle in, I'll just approve them. So, welcome to Family Peers for Hope's Family First Wednesday. My name's Linnea. I am the president of the organization, filling in for Beth Ayers, our executive director, as she is teaching a class today in Helena. So I am excited to introduce Dr. Nicholson, who I actually also work for. So it's kind of double dipping today. And we'll go ahead and let her talk about Montana Developmental Assessment Clinic and a little bit more about autism. So Laura, if you go to the bottom of your screen and have that share button it's the green arrow
Uh-huh.
and you click it, it'll allow you to share your screen that will show the presentation.
Entire screen, and then just pull up the,
Yep, and just pull up your presentation and it should allow you to go through the slideshow.
what do you see now?
Just nothing yet.
Do I hit share maybe?
Yeah.
I don't see how to do this.
Okay, so click the arrows, the share, and then it'll give you an option. So pull up your slideshow on your
Okay.
screen and then go to the Zoom button to share your screen. Click on the window you want to share and click share.
Open system. I'm sorry.
That's okay.
I should have done this before. So it's
If
asking
not,
me to approve something to share.
let's see. Should be fine, but you know what I can do? I can just, if you want, I can just pull up mine and
Would you
give
pull
you.
yours up? Yeah,
Yep,
thanks.
that's totally fine. Give me one
I want
second.
people to wait while you get me through this. I'm sorry, guys. I'm still somebody who my kids grab my phone from me or whatever and say, "We'll do it, Mom."
Okay. Now I'll just open up my email address.
So I'll start talking. So I'm Dr. Nicholson. I'm a developmental pediatrician, partially retired. I decided when I retired that we needed a developmental assessment clinic, and lots of people agreed. So um, that's what we started was the Montana Developmental Assessment Clinic. And Linnea's been my program manager for 3 years.
Mhm.
So she really runs it. Um,
Sorry, I'm logging into my email address. Where's okay.
so when I started this clinic, um, I don't know anything about business at all. So I went to STEP and they sponsor it. So they actually own it and um, but
Oh,
we run it.
dang it. It's not showing up. Oh, okay, give me one more second. Let's.
I'll try again with mine.
All right, try one more time.
Is it doing it yet?
It's coming. I just, when I sent it
No,
to
I mean,
myself, I
it's
didn't
mine. No.
send the attachments. Oh, yeah. If you go ahead and make it into a full screen, it should be fine. If you
Are
go
you?
to view at the top, go to view, keep going over. Keep going the view button.
Okay.
Yeah, it doesn't look like it's pulling up.
So do you see it yet?
I can see the screen, but it's not full screen. Slideshow. No, click it again.
Well, let's just do it like this, if you guys don't mind, rather than waiting, having you wait. Um, so anyway, we're the Montana Developmental Assessment Clinic, like I said. We really are a interdisciplinary autism evaluation clinic. So we only take kids who have the question of autism. We serve kids 18 months to 12 years. In Billings, it's in Billings, it's September through May because this is my retirement project and I didn't want to work in the summer. And we do bill insurance. And yes, Linnea has made us a website, so you can find things on the website. My goal is to provide accurate diagnoses to help parents and caregivers understand these children and then provide a path for intervention. So, really, so people understand them. And why I prioritize autism? Because can be really hard to figure out, much harder to figure out than maybe cerebral palsy, for instance. And early intervention in autism can make a huge difference. So I'm sure I'm just talking to the choir here. I mean, you guys know that what a difference that makes. So, what is autism? To remind everybody, autism, the core deficit in autism is an impairment in social communication and social interaction, or a difficulty in understanding others' perspectives, also called theory of mind. We instinctively have the drive and ability to look at others and think about what they're thinking. But in autism, there's a deficit in that, in the instinctive ability to understand social communication and social interaction. It's not always easy to figure out, right? What works, what where the deficit is. It can be easy and obvious. The child that's in its own world, the child who doesn't look at you for an hour and a half and goes around doing their own thing. Well, that kid has autism, but it can be hard. And so we created this clinic to serve those children who are hard to figure out, who need an interdisciplinary clinic to figure out their diagnosis. Any questions so far? I can't see you guys. It's tricky. We have to look closely at their social communication and interaction, including theory of mind, the ability to take others' perspectives. So we mainly use our clinical expertise as a team. We do the ADOS, which is an autism diagnostic observation scale, doing activities and then looking objectively at their social communication. It's really a structure so you can look at the kid. It doesn't just give you a score, but really sort of what is going on with that kid and why aren't they communicating with you. Speech skills like pragmatic social communication skills, direct measures of theory of mind, and informal. How do they play? Really, how do they play with us? How do we know that their social communication and interaction impairment is due to autism? There's other factors that might affect social communication and interaction besides autism. Like there's other deficits, including just speech delay. Some kids can't talk to you or can only say some sounds, and so their language is pretty atypical. We had one kid once who I just thought was confusing. She wouldn't use the word I, but then it turns out she couldn't say I. So overall developmental delay is a big issue. ADHD, not able to interact as they're distracted all the time. Could be anxiety or depression. We had a kid last month who just lay his head down, and yes, he flunked the ADOS because he wouldn't interact with us, but it was clear he had depressed. Trauma can mimic it, and just medical issues like lots of seizures. So we have to look at them and test. We have to do development. We have to obtain a measure or measure their developmental skills. Look at their speech skills with a speech therapist. Do questionnaires and observation to see if they have ADHD, or anxiety or depression. Trauma, get a good history, and then medical issues. And then we have to answer if those conditions are causing the problems with social communication and interaction, or the child has autism and also has those other things. So it's a difficult process. It's very extensive. We do questionnaires and interviews before the clinic. We gather all their records, or say Linnea gathers all their records. We do a clinic with speech therapy providers, ADOS providers who are almost all speech therapists, special ed, which is Linnea to do developmental tests, occupational therapy. We're lucky we do it at the University of Mary, which is an OT school. And so Paula Kitzenberg does them with us with her students, which I think is great because we're training the next generation of OTs. Medical, and then we meet them and discuss what we think. And then we have to give feedback to the parents, and then we have to get the reports out. So lots. In addition, to help clarify things, to have autism, a child must have 2 out of 4 rigid repetitive behaviors, restricted interests, or routines. Like stereotype repetitive behaviors or speech. You guys know these, right? Flapping, lining toys up, echolalia. Intense interest, rigid non-functional routines. I always have to remind people, not bedtime routines that help, but just idiosyncratic weird ones, like always having to use the same cup and that kind of stuff. Sensory differences, like food's a common one. And everybody says their kids are picky, but these kids are really picky. Like they'll only eat 6 things or something. Sometimes they smell everything. Sometimes they have visual differences and look at things differently. So you notice I haven't gotten to this issue until now because the core deficit is in social communication and interaction. These are things you also have to have and help sort it out, but they're not core difficulties. And again, why is the diagnosis important? Early intervention is the key to giving these kids skills. I think it's because social communication and interaction are developed between age 1 and 5 in typical kids. You could say 0 and 5. And so we can teach children skills and social engagement. And we know if we intervene during this time, and the earlier, the better, even in that period, the more progress the kid can make in social communication and interaction. So you guys would find this is interesting. So if you look at the studies, they're all in like 2 to 7-year-olds. And when you look at, sort of the meta-analyses, when the younger the kid is in each program, the more progress they make. So the younger you get them, the better. But older children will also benefit. Sometimes they still need help with basic engagement skills, but they also can be helped with more advanced social cognition skills, like learning more about perspective taking, or how to converse or play with others, or working in a group. And the speech therapists always like to bring up this tree about the root deficits and then all the things that you can teach the kids to help that. So future and DPHHS. We used to have evaluation and diagnostic clinics in the state. They look different depending on the region of the state. Some, like Deep, did a more general thing where they followed kids. CDC did their own thing. In Billings, we decided we wanted a clinic for children whose developmental presentations were hard to figure out. So we met like in 2007 or no, anyway, early 2000s. And so for about 15 years, Billings and Great Falls had a clinic called Full Circle. DPHHS stopped funding it in 2017. If you guys are part of the state, they'll argue that yes, they put out a request for proposal, but they said that the people who staffed it couldn't take Medicaid in their regular practices, which meant there wasn't anybody in Montana. So anyway, they essentially stopped it. I started this clinic based on Full Circle, but we do it a little differently to make it more efficient. We just see more kids per day and just do it a little bit differently. Um, the last legislature, uh, we went to the legislator and asked to get it funded again. And they awarded DPHHS, developmental disabilities, to restart the E&D system, evaluation and diagnostic clinic system. But they haven't figured out what they're going to do yet. They do have a committee to plan it, but because of their fear of conflict of interest, there's no one on the committee that actually provides diagnostic services. Um, but I'm hoping that they'll do the right thing and fund a clinic like us, Montana DAC, to spread all over the state. So I've been hoping for that. Questions?
Laura, there was one in the comments about what about a kiddo who has a higher IQ, but social skills and communication are some of their needs? How do you differentiate that?
Well, it's again, it's not easy. It's pretty much the same, even if they have a high IQ, right? You're looking at their social communication skills um, with the ADOS, and you do lots of talking as opposed to just playing then on how well can they, um, how do I get back into this? How do they get, do you know how I get into this again with the participants? Um, show me. I'm sorry. So you do more talking than you do playing at that point. And we just talk to them. And actually, there are measurements of theory of mind where you can really measure whether or not this kid has perspective taking. So you do a lot of that. We do a lot of trying to figure out if it's something else, right, at that age. The older kids are harder, right? The younger kids seem more obvious. The older kids are ones that people have missed early on if they do have autism. And so I find them a lot harder. Um, but so you do a lot of talking and trying to figure out if they have theory of mind and whether they have something else. Is that helpful?
Amy, go ahead and there you go. Do you have your hand raised, Amy?
Uh, with this child in particular, they did not get a diagnosis until he was 9, but they are withholding education. The only assessment that they have done is as far as seeing that he has an over 100 IQ, but it's just a lot of exchanging of notes. Nobody is actually providing the assessment so that the parents can advocate. So I'm just wondering
Nobody's
if,
providing the assessment that was done, or
yeah,
nobody.
they just say his IQ was over 100. So yeah, it's been a long, it might have to be a conversation to see if there's a way to get support for this family because mom and dad both work. They have insurance, you know, yeah, it's kind of a difficult deal.
So I don't know, Amy, there's lots of questions there.
Yeah.
But one thing to talk about is the diagnosis of autism medically is different than school because the school only cares, only um, will provide services if their autism is definitely affecting their educational progress, right? So if the
Well,
kid can be in a regular classroom without extra supports, the school says, well, I don't, the autism makes no difference. Now remember, SSI thinks the same thing, right? Everybody thinks it's a functional diagnosis. And if it's not
well, and
with
he's been
education,
he's been in and out of show dare, in and out of emergency rooms, psych centers, you know, and because of my experience, I can see all the things, but it's not my job to, you know what I mean. Um, I'm just trying to find them some support because they're not getting any to even get a plan.
Linnea, are you thinking? Are you thinking?
Amy, my suggestion would be to have the parents reach out to Montana Empowerment Center. That'll probably be
They've
a,
been working with Sandy, but
yeah,
there's some missing links.
parent support on the educational side is hard. Mostly because there's just the school system, especially here in Billings, has so many kids going through the system. And so, definitely my couple recommendations. So, Montana Empowerment, and then all requests should be given in writing, to either email or mail or whatever that looks like for paper trails, and just request support. Have the schools look at the child, do some evaluation, do some observations, but make sure they're keeping a paper trail of that so that the family can come back and say, well, we've requested some support and this is still where we're at. Again, like Dr. Nicholson said, the school is going to come back and say, if there's not an educational need, then we're not going to necessarily provide specialized instruction. So looking at a 504 instead, or looking at different accommodations that can be given in the classroom. So Sandy is great, and Sandy should know kind of where to go from there. But definitely have things in writing.
You've got this group here that can probably help. Although, Amy, the more I'm thinking about what you're saying, it's not a school issue. If he's going to Shodare, that's not a school issue. That's a home issue or a community issue. Can't
Yeah,
be supported in his community.
yeah.
Okay, so that's we kind of took off on the wrong thing here. So,
Next question is, how do you fund your clinic now? We had a few people coming in late. So how do you fund the clinic now, and where are you located?
we fund the clinic actually with just what insurance and families do it. We bill it like a regular clinic. Um, and then, and obviously we work with families who can't pay. It's about 60% are on Medicaid, and that's easy. And then I don't get paid as, we just don't get paid as much as you would in a regular medical setting. Um, and STEP helps us get through some of our low parts of the year. Um, but in general, it's just, I haven't gone after grants there. It's just funded medically, through regular billing. What was the other question? Oh, where are we located? We're not really located much of anywhere because everybody works from home except when we have clinic. Luckily, we've worked, you guys might know Paula Kitzenberg. She's taught most of the OTs, and she's the head of University of Mary. And so we actually have clinic at University of Mary, and often her students join us and do assessments and learn.
So next question, Jennifer, do we have a wait list?
Linnea, you want to explain that? Linnea does
Yes.
it.
So in case you guys missed it, I'm the program manager for Montana Developmental Assessment Clinic. So I kind of organize until we get to clinic, and then once we get to clinic on our Fridays, the team kind of takes over. So the behind the scenes process goes typically, so we see kids months September through May, and do 3 clinics a month, so 3 Fridays a month. So we do require that PCP send us a referral. That's kind of one of the requirements that Dr. Nicholson has for seeing a child. So once we receive that referral, I do a preliminary evaluation on it to see if FIRS were appropriate, if they meet the age requirements, those types of things. and then they go on a referral list in the order they're received. And typically, the first 5 months of clinic, there's no really wait list. We just go in the order that they were received. Because we end in May, we have way more referrals than we have spots left. And so, new referrals and a lot of the referrals that were received within the past couple months, they will be seen in the fall. So, we don't really have a wait list. We just go in the order that they were received. And then towards the end, we have to kind of figure out which referrals we're going to see before the end of the year. Okay. Amy asked another question. Um, Getting an assessment outside what the school has done. So is there a way to get another assessment outside of what the school has done? Amy, are you thinking IQ wise, like performance wise, or are you thinking medically?
More in depth as where he has the deficit as far as communication skills and expressing his feelings, what is triggering behaviors, that's kind of where we don't know because they just said he's got an over 100 IQ.
So, Amy, how old is he?
He's 9.
And I mean, we could talk about doing it. There's also, and then there's also some psychologists, but not so much in Billings that can help.
Right,
Shodair probably did quite a bit, but because Shodair has a psychologist who gets involved.
right.
On top of that, Amy, I mean, so looking more neuropsychology evaluation to really dig in deep because that's going to be a much more in-depth assessment as far as they're looking at. But also just remembering that a school can take those medical diagnoses. It doesn't mean that they're necessarily going to provide services if it's not impacting his school function.
But
Um,
there are some psychologists in Bozeman or Helena, if you want, that we could share with you.
Morgan, I guess, let's see, we've been discussing this issue. What is your question, Morgan? Are you asking about what insurance coverage covers, or um, I guess I'm not quite sure what your question
Yeah,
is.
I am curious. So earlier, someone, maybe it was you, Dr. Nicholson, who mentioned that you're billing for services through insurance and just medical billing. And I'm really curious. I've had some discussions with the folks who run the psychology clinic at University of Montana and the lack of insurance coverage for assessments on the whole regarding just like outside of school assessments that may need to dive deeper beyond just initial diagnostics, or if the schools are too crowded and can't get to them in time. But a lot of providers on campus have complained that uh, just their parents are having to pay enormous sums out of pocket. So I'm
So
curious,
there's
is there
a couple
something that
of
I don't
issues
know?
here. There's a couple of issues here. One is psychology. I haven't been able to get a psychologist to work for us because they don't get paid well enough. I had a psychology student for a while, and then that didn't work out very well. So that has been really hard. They don't pay great, although some PhD psychologists will do it. Will take it, take Medicaid, excuse me, and insurance. The and so we're doing ADOSs and developmental tests, um, and we get paid okay. Um, what do we get paid? Like 1,200, 1,500 per assessment. I guess we figured $1,800 is what it cost we get. Um, so not well enough that you could hire somebody who wasn't retired to run it. So, um, doesn't get paid great, but we get paid well enough
The
to
other
keep
per
going.
Morgan, is that we aren't doing developmental assessments for kids over the age of 7. So I administer the Battelle, which is another tool that SD2 uses here in Billings for our younger kids in preschool, but we can't do IQ tests, and so we're only looking at development for kids under the age of 7.
Helpful. Okay, thank you.
And that's one reason I want the state to take over. Because if the state would take it over, um, then maybe we could, afford to do it and spread it, right? Um, you're at, I'm sorry, where are you? You're in Missoula?
Yes, I'm a parent in Missoula, but I volunteer for the psychology clinic on
Oh,
campus and
cool.
work on campus and other
Yep.
arenas. But yeah, there we've just consistently talked about assessment, the challenges there, especially without insurance coverage, and then the the possibility of what it could look like to do assessment differently. So I was just super curious about um, how everybody's managing it. And I think your thoughts on the state make a lot of sense, or at least getting additional funding from the state makes a lot of
Right.
sense.
Right. And I would love, I mean, my dream is that we spread this clinic and that instead of a developmental pediatrician, because there won't be any developmental pediatricians soon, so that that we have, pediatricians who are very interested in this. Because really all we need to do is add the medical stuff and I empower everybody else to do their thing, right? Would you say,
Mhm.
you don't need a doctor to do most of the diagnosis. It's developmental, and they're better at that than I am. Um, and then we could spread it, through the state. That's my dream. Um, I have a slightly different philosophy than DPHHS or DPHHS cares more about qualifying for like the waiver, and I care more about accurate diagnosis and guidance. And so we don't always see eye to eye, but hopefully we can compromise.
There any other questions from those that are watching for Dr. Nicholson?
Do your assessments work outside of SD2? Do you do throughout the state if people come to you and for different
We
districts?
do see people from all over basically eastern Montana. And sometimes I'm not sure what the really rural places take, but like Hardin and Colstrip can't do the kind of assessments, even developmentally, that we can. Um, so I think people are taking them um, from those
Perfect. Good.
rural places. We're lucky that we got Linnea from the school district, and so they'll take her assessments. So hopefully, I can keep replicating that when she leaves me. Um,
Use that leverage.
yeah, hopefully, but because it's just nice for the parents to do a one-stop shop, and then for us to know where they can get served in our own recommendations for them.
Thank you.
Yeah. Psychology is tough, though, to actually have a psychologist do neuropsych. They don't take Medicaid. Well, in Billings, they won't, and we hardly have anybody. You guys are better off in those cooler places like Bozeman and Missoula. Um, so you guys have, Bozeman, Missoula, and Helena do. And of course, the community clinic, Missoula community has a clinic that's pretty similar to ours, except they are in Missoula, and so they have psychologists who are part of their clinic as well. And they can actually give you an IQ score and really handle the older kids better than we can. They have a wait list. It's like a year long though now.
There any other questions for Dr. Nicholson?
What do you guys have any other, since we have a minute, do you have any other thoughts about what the state should do with the END clinics? if there's anybody on the call who's been helping them.
What do they tell you when you say that you want to spread this around? Like, what does the state say to you?
They don't know what they're doing yet. They have lots of competing ideas, from very straightforward developmental assessment or things that I would think of as high risk clinic, um, to something more complicated like we have. And like I said, it used to be that the areas could choose what they were doing,
Oh,
but because in Billings, we didn't feel like we needed basic developmental assessments that we could get from ECI and the school district. We wanted more complicated ones,
okay. Thank
which
you.
I see this assessment. Our clinic is trying to diagnose kids who are harder to figure out.
Dr. Nicholson, do you want to share the what percentage of kids we see that are actually receiving an autism diagnosis when they come through clinic?
Yeah, actually, I should have mentioned that. We only have all the kids who are referred to us, people think have autism. Somebody thinks has autism, including their doctor. Um, and only 60% of them do. They have one of the other things we discussed, um, developmental delays, speech problems that are unusual. Um, so people haven't picked up on that. ADHD is a big one. Anxiety is a big one.
How are you differentiating between autism, ADHD, trauma, anxiety?
It's hard. You have to look at the kid and all the associated things. And then, it's really interesting, guys. The ADOS, some people will say, well, it's just their ADOS score. It's not, because the ADOS score just tells you how well the kid uh, does these social skills, but it doesn't tell you why they can't do them, right? And so you have to look very closely at the kid and see how. Um, the other thing I think we do well is we don't follow the rules necessarily. We give them a lot of support. I mean, Linnea will practically sit on a kid to give them enough sensory support to answer her questions. We'll let them bounce around and give them sensory stuff to get them focused, and then attempt the assessment. So, like I said, you have to gather a lot of information and talk to them for a long time to figure it out and get them the support they need to make sure that you know what they can do best, and when they're all supported, what they can do.
Another one is how about the time that we're spending with each child from start to finish? About how many hours does a kid get either direct observation or assessments and indirect? Like, what's the total number, do you think, of hours?
I know I spend about 8 hours per kid, um, including their time in clinic. So it's a lot. Writing the reports too. Yeah.
I have a
Yeah,
question.
Jennifer.
Yeah. Um, I used to work at CDC for 30 years.
Great.
I was around for the E&D part, so I
Uh-huh.
understand more of that. It's too bad that they took that funding away. So being a part of that team, um, obviously after the assessment recommendations were provided, and then I was assigned as a family support specialist, or for your clinic, I'm assuming they leave with recommendations, and then how do families get the follow through with those referrals? Because waiting lists, I mean, everything now is stacked upon each other, like the developmental specialty clinic you just mentioned with Bonnie Stevens. Um, Long waiting list. So you guys do such a great job in assessing this child, and then what happens moving forward after
That
that?
is a really good question, Jennifer, because if they have early intervention, I do the feedback with early intervention and let
Okay.
them take over. but then of course a lot of people don't. So, we're counting on families to do it themselves or with grandparents.
Okay, and especially with the lack of, you're just saying psychs, like we obviously, I work with the older kids now out of family outreach, excuse me. So I work 3 to 16. So again, my mind, the 0 to 8 DD, the IQ testing you were mentioning, trying to find therapists. Luckily, we have Kathleen Gallagher still here, my mentor, years back. So because school districts legally don't have to provide IQ testing. So I was
Mhm.
just curious, like, seeing the change in services occur right now and services being depleted or merged with other, like mental health or Western Montana Health is merged now with Aware. Um, it's like I'm just wondering how families are getting the support systems they need when I'm there once a month. Do you know what I mean? Like, so what other for me, like what other outlets could I help families with? Is that kind of where I'm going?
You mean so for family support?
Yeah, so if you so can you give me an example of maybe what a couple recommendations? So a family leaves with recommendations, they have a report, correct? They leave with recommendations. Do you have connections with professionals? Like have ideas of who has openings or options for families?
Um, yeah, mainly though, I give them a list and then I give them a list of who I think would be good matches.
Okay,
Tell them to get on their waiting lists.
okay,
Um, we have some counselors who are particularly good with kids with autism, so we can direct them. But you're right, it would be nice to have a family support person who would continue to make sure that they didn't hit a roadblock and then dropped it, which is what
okay,
can happen. We can connect them to Head Start. We have some connections. And if they
yeah.
really need neuropsych, actually, I've been recently trying to find them neuropsych and then tell their doctor where to refer. Um, but it's not in town.
No, and those wait lists are over a year too. Like Missoula, I mean, those neuropsychs are getting full. And then again, you might have funding hiccups, especially if they're insurance. Like
Hmm.
those pay that those are costly assessments. I was just
Yeah,
curious if you
most of
guys
our
are,
kids are on Medicaid, so we're finding that.
yeah, yeah. I mean, and I was just wondering if there's something out there that I'm missing or you had.
I don't think so. I mean, and if you're really disabled, we'll refer them to STEP, if they'll get, or DEEP,
Mhm, yeah.
or depending on where
Well,
they're.
and now the state has control of our wait list. So yeah, that started in October. So again, how the state works, I don't timing. We don't know
Your
how that.
wait list, or do you work for DEEP?
I work for Family Outreach. So
Family Outreach?
Region
Yeah.
5, since CDC is no longer, uh, Benchmark took Bertha 3. They have that contract and Family Outreach, Helena Butte and Bozeman. I'm in Missoula. So we have a Kalispell team too, but there's just 2 FSSs in Missoula. And then there's an intake coordinator and a couple part-time FSSs and 1 full-time in Kalispell. So I, again, just kind of, as I've seen systems change, I was just curious if you guys are having more success or how that's looking for you guys. So yeah, the state took over our regions, the whole region, all of the state of Montana's wait list for services. So once they exit out of benchmark, I mean, they're put on a wait list and then it's on a matrix score on who, and then the regions are decided by the state of who gets what kids that are on the wait list.
Hmm.
So we could have families that are on the wait list longer than I think they should be, but we don't have any control of that wait list at this
Right.
time.
Right. Hmm.
Do you imagine as the family peer support develops, it will be not a good total solution, but a good support while the waiting list and while the navigating services?
I'm sorry, as what develops? I'm sorry.
The family peer support.
Yeah, I mean, I think you guys, something like for answering Amy's questions, are are really helpful. We have had peer supporters when they worked for Children's Clinic, they would come over to our clinic, and take over for those kids. So that is a really great idea that we referring them to family peer support and trying to, do you guys think? And trying to get those workers then, because then we'd have somebody staying on top of them to make sure, because parents tend to give up, right?
Right.
Yeah.
Well, questions, confusion, frustration.
Yeah. Or they'll say, oh, yeah, I've got on that wait list and I've been waiting. And I'll say, how many months? Well, like 3 or 4. It's like, well, have you talked to them? You know, it's like,
Amen.
yeah, yeah,
And
you've all been there. Yeah.
and wait lists, depending on the facility, like people, I worked for organizations that like that was a really big no-no if you didn't contact the patients about wait lists. But when I'm a parent and I'm like going to all these different small organizations, they don't follow up with you, so I would have to follow up every 3 months, and I'm still on wait lists in Missoula, and I don't even live in Missoula anymore.
Yeah. Do you think then that, I mean, that's a good idea that we could connect better for peer supporters, right, Linnea, with our kids?
Mhm.
Yeah. And then that certainly could be sort of incorporate, especially as you guys start getting more certified and et cetera, that maybe the E&D clinics should have sort of a direct connection there.
Sure.
That's a really good idea, Brent, to fill that gap.
I mean, Montana Family to Family is already doing that.
Yeah, they're
We're
working
peer
with
supporters.
yeah, there's
No, I
somebody
mean,
on,
we're peer supporters.
right, right. And actually there's somebody on from Family to Family on the committee that's making E&D. So I was hoping that would, the DPHHS committee.
Dr. Nicholson, you have a question on, do you have any connections in Wisconsin for assessments or know of any places there? Wendy must be
Wisconsin
from
or
out of
Wyoming?
It says WI. I'm hoping it's Wendy, did you mean
Wisconsin.
Wyoming? Wisconsin.
Wisconsin.
I don't know anything about Wisconsin, I'm afraid.
How
It's all
close
right,
are they
thank
to Green
you.
Bay? How close are they to Green Bay?
6 hours, I think.
How many hours?
6, I do believe.
Oh, okay.
Yeah.
Okay.
I'm in no man's land.
Oh, okay.
Yeah.
What's your closest city close to you?
Good question. Let's see. I see Minneapolis, but that's in Minnesota. That's 4 hours. Mm. We'll have to get back to you on
I
that.
can get you I'll put my email in the chat. Shoot me an email and I'll try to help you out.
Thank you.
I mean, every state has Family to Family somehow.
Yeah, I was gonna connect you with them.
Okay.
Oh, someone said Brenda moved to
Neuropsych. Okay. I know Duluth isn't too far. That's hour and a half.
Yeah, shoot me an email and I'll help you.
Right, were there any other questions for Dr. Nicholson? Okay. Well, we appreciate.
So I got an email back. This was in 2024 when I first did that first.
Oh, must have been an accident. All right, so we appreciate you guys all tuning in for our Family First Wednesday with Dr. Nicholson. I will go ahead and have our executive director, Beth, send you guys the slideshow. There were a couple of people that came on late and wanted to have access to those, so those will come. And everything else, we appreciate it and keep an eye out for the next one. So thanks, guys.
Thanks.